acne, it doesn't discriminate against age, gender, or race. But it's personal when it's you who's suffering with it, right? Not only do you feel subconscious, acne can leave scars, but there is new hope. Dermatologist Dr. Max Adler and his assistant, Sandra Witten of Park Cities Dermatology, are here to tell us all about breakthrough treatment. First, let's start talking about what acne is exactly.
Well, acne is a disorder of plugged pores and an infection with a bacteria called P. acnes. And acne comes in many different flavors. You have the pustular acne, which everybody knows, the little whiteheads. You've got comedonal acne, which is the kind of translucent plugged pores. And then there's deep underground cystic acne that everybody hates, that you get right before a big party or something like that. Yes.
Okay. Now, we know that puberty usually brings about acne.
Yes.
But what about the grown-ups? Is it late onset puberty?
Absolutely. Grown-ups are not immune, especially we females have hormonal triggers. And we all know before our menstrual cycle comes, we can get a breakout with acne. So adults can be affected by it. Teenagers obviously are affected by it. No one is immune.
So what's going on down in the hair and the pore that is causing this outbreak?
What happens down on the hair follicle is that the skin cells will stick together. And when they stick together, that forms the plug, whether the plug is high in the hair follicle or lower. Now, what happens then is that bacteria are also going to produce inflammation. The body produces inflammation to try to get rid of that inflammation, which actually makes the problem worse. So what we're trying to do with our therapy is to decrease the inflammation, decrease the plugging of the pores, decrease the number of the bacteria, and then hopefully with medications keep the pores empty from then on.
Okay, but you told me there's new hope. Tell us about that.
There is. We've got a new machine that's called Isolase. There's only about 100 of these in the United States, and we have the first one that's in the Dallas-Fort Worth area. And this is an interesting machine that is a very easy treatment at this point, where the skin is prepped, and then treatment parameters are chosen by the technician and by the doctor, and then the machine is put on the surface, and this is virtually painless, and a little bit of suction is applied, and that helps to empty the pores. And right after the suction takes place, then the light flashes. And the light is not a gimmick. The light is actually killing a number of the bacteria that are down in the pores.
How long does this take?
Usually a treatment's going to take anywhere from about 20 to 35 minutes. Like I said, it's virtually painless. We recommend these treatments be done about every 2 to 4 weeks. They run about $325 each. We can do maintenance treatments if people have an ongoing problem. But it gives us another way to treat acne, and we also can eliminate or at least reduce a lot of our intake of oral antibiotics as well, which is a big plus.
So you said with 2 to 3 week intervals, for how long a period?
Typically 3 to 4 treatments. We're going to see some really good changes.
All right. Speaking of seeing some good changes, you've got some before and after pictures. Let's take a look at some of those. And as they say, the proof is in the pudding, right?
True.
Here we go. Oh, my.
These are pretty remarkable, and many of these are going to be within, let's say, a 2 to 3 month period, okay? And a lot of them are also going to be in combination with other medications, both surface and some oral antibiotic as well. And you just have to do whatever it takes to get a person clear, because what we're trying to do when we see a patient is trying to prevent scarring. Because once the scars are there, that's even more expensive to try to treat, and it's much more costly.
Wow. All right, so with this, my goodness, look at the difference there. So, and these, you're seeing different types of outbreaks on each of these.
Exactly.
So it's pretty universal, no matter what type of acne you have, this Isolase is able to
It helps.
Yeah, get the job done without the use of antibiotics as well, right? Would you use a topical, though, in association with this?
We usually do, yes. We usually, we talked about Retin-A last time.
That's right.
The retinoids, the Differin, Retin-A, Tazorac, those are always like brushing your teeth for your skin. But what's wonderful about this is it can reduce our dependence on antibiotics. We can always use it in conjunction with it. But, you know, if someone doesn't need antibiotics or they're vehemently opposed to antibiotics, it's a great alternative.
All right. Thank you so much.